Hello, I'm Jonathan Nelson for the Illinois Academy of Family Physicians with a special report on Medicare. The program provides health coverage for 43 million elderly and disabled Americans, some of whom may soon find it increasingly difficult to get the care they need. The Centers for Medicare and Medicaid Services have proposed a 15% cut in physician payments over the next 2 years. What's worse, the Medicare Board of Trustees projects that if the current payment formula isn't fixed, physician fees will be cut by about 5% each year until 2016. That's a 40% cut over 9 years. In a program that frequently doesn't pay physicians enough to cover the cost of the services they provide, these cuts will surely force physicians to reduce the number of Medicare patients they can afford to see.
Many physicians, unfortunately, are being forced, based on the economics of the situation, to limit their practice at this point and no longer see Medicare and Medicaid patients.
If these Medicare cuts that are looming come true, it's going to put, I would bet, over half the house call doctors in this country out of business because they just cannot afford to take a 10% hit to their bottom line. They just can't.
The proposed cuts are the result of a flawed payment formula designed to control Medicare spending and utilization by restricting payments to physicians. The Sustainable Growth Rate, or SGR, sets an annual spending target for physician services. If spending exceeds that target for the year, Medicare reduces payments to physicians to make up the difference. But cutting physician fees doesn't decrease patients' demand for services. And as the nation's aging baby boomers begin to enroll in the program, there's no question that demand is on the rise.
Unfortunately, family medicine is a business, has to be run as a business. If we don't run it as a business, we end up closing the doors and nobody gets care, which is not what we want. We want to provide the best care we can, reasonably priced. At this time, our system does not do that if you look around the world.
It's difficult enough as it is now. We're preparing, we're making our adjustments for pay for performance, and just having the Medicare fee cuts will just make it that much more difficult. Cutting into a margin that is already pretty razor thin as it is makes it very, very difficult for us.
It may cost me employees. It may cost not replacing equipment that needs to be there, like x-ray machines, lab machines, whatever, which adversely affects my patients.
Since most health plans base their fee schedules on Medicare rates, the projected cuts will drive down physician payments by private insurers as well.
Every time there's a change in an insurance provider, then the patients have to seek a different medical home. They have to find another place to go, as opposed to that long-term relationship that we so enjoyed previously in regards to family medicine.
Several recent studies have shown that in areas where primary care physicians provide the majority of care, Medicare patients receive higher quality care and better outcomes at a lower cost, potentially saving billions of dollars in the Medicare program. That's why your academy is working together with IAFP to make sure Congress fixes Medicare's flawed payment system so that America's senior citizens have access to the care they need.
Over a period of time, we cannot have a system that doesn't have good primary care physicians at the front end.
Obviously, we're going to have to make a fix if we want family physicians to actually be able to afford to take Medicare patients. We don't want to see people finding that when they go to a doctor that there's actually an office policy now because those reimbursements are inadequate. And I'm particularly concerned about family physicians because, there's a lot of talk now about a medical home and what an advantage that is for people to have their family physician, someone that they know a relationship with. And yet, if we don't reimburse properly, there's not going to be any time at all for those physicians to spend with people, even if they do take them. And I want to see that family physicians are properly reimbursed for that kind of relationship too.
What we need is all the family docs to band together, come together at a grassroots level and show the government, basically, that yes, we're serious about this, we need to get this together, we need to be on the forefront, we need to be out there, we need to be proactive and not reactive.
For more on what your academy is doing for you, and to learn how you can get involved in the fight for family medicine, log on to the Academy website at www.iafp.com. Reporting for the Illinois Academy of Family Physicians, I'm Jonathan Nelson, and this has been your Academy in Action.